So this is a second post hoc analysis of the the study from the DeFi study, which is looking at patient-reported outcomes in those patients that had stable disease on the DeFi study. Here we go. And here's the authors of the study. These are my disclosures. I'm not going to spend time describing what desmoid tumors are to this group, but it is here on the slide if you would like to see it. But important to recognize that treatment goals are not limited to simple radiographic improvement. We care a great deal, as this group knows, about symptomatic improvement, specifically in pain, but other things as well. So again, the DeFi study, I will summarize for all of you one time, that it did meet all of its primary endpoints. There was a 71% reduction in progression-free, 71% reduction in the risk of progression in patients receiving nirogacestat versus placebo, an objective response rate that was improved in those patients receiving nirogacestat versus placebo, 41% versus 8% by RECIST. And PROs that were pre-specified analyses were also all improved in patients receiving nirogacestat over placebo. So in this analysis, we're not going to be looking at those patients that had responses, but we're going to be looking at that large slice of patients that didn't have progressive disease, but also didn't hit the threshold for a RECIST response to treatment. And it turns out that this was a big chunk of patients. About 50% of patients on the nirogacestat arm and 76% of patients receiving placebo had stable disease as their best response on the trial. And you can see that those patients are roughly a cross-section of patients on the study. 2/3 were female. Median age was 34 in both groups. And it was a mix of treatment naive and pre-treated patients. As you will recall from the prior presentation, a battery of different PRO tests was assessed in each of these patients. There was a brief pain index, brief pain inventory short form, the Goddess symptom scales, and the EORTC QLQC30 instruments. And here's what this looks like. So now, in contrast to the figures that were in the primary manuscript, these are just patients that had stable disease as their best response by RECIST. And you can see here again that that the curves separate early by cycle 2 and remain separated throughout the analysis. The pre-specified endpoint for looking at this was at cycle 10. And at cycle 10, in both the BPI short form as well as the Goddess symptom scale and impact scale, there's a statistically significant improvement in those patients receiving nirogacestat versus placebo. Similarly, in the EORTC QLQC30 PROs, physical functioning is improved, role functioning is improved, and overall quality of life, you can see that those curves don't seem to separate quite as cleanly as physical functioning, role functioning, or pain in the other figure, but at cycle 10, which was the pre-specified endpoint, there is a separation between those two curves that is statistically significant in favor of nirogacestat over placebo. So the conclusion here is that in that subset of patients that have stable disease, we still see measurable improvements in the PROs that were assessed on the DeFi trial.